So once a patient is referred to our office for a tooth extraction, the procedure starts with a consultation. It's important for the patient to bring any x-rays that they may have of this tooth that they're being referred for, or ask their dentist to send us x-rays. Oftentimes we will wind up taking our own x-ray. During the consultation, we will review the patient's medical history to see what medical conditions they might have, which might impact the actual procedure, and then discuss with them whether or not this tooth is being planned on being replaced in the future with a dental implant that alters the procedure a little bit. But in general, the consultation will involve an x-ray, an examination of the area, as well as a review of the medical history. Then the patient is either scheduled to have the tooth extracted on a later date or extracted the same date, depending on the patient's pain level and their desire. The procedure itself for the extraction involves most of the time having the patient under sedation, which is an intravenous procedure where some medication is given to the patient and they fall asleep, being very comfortable while I do the procedure, and then they are easily awakened 20 or 30 minutes later. After the tooth is removed, the area is then normally sutured or closed with some dissolvable sutures, and the patient is prescribed medication to take after the procedure. If the patient came in with an infected tooth or an infection, then usually antibiotics are prescribed, as well as a pain medication and a medicated rinse. The patient is then seen several weeks later to check on them to see how they're doing, and then depending on the plan, whether this tooth is going to be replaced with an implant or not, will require some follow-up visits versus just an extraction, which won't require any follow-up visits. Discomfort is very minimal, lasting a day or two of some soreness. If we're removing wisdom teeth, the discomfort can last 2 to 3 days and a little bit more swelling is involved. But for the most part, an average tooth is a day or two of some mild discomfort.